All right, so here we are looking at different ways to treat TMJ, or temporomandibular joint dysfunction. We're going to be using a combination of myofascial techniques that is instrument-based and cupping-based, or distraction. So I'm here over the external aspect of the TMJ, working with instrument-assisted technique, HawkGrips, and coming along the posterior aspect into the mandible. And I can start changing fascial pressures by having the client essentially close his jaw and open his jaw. So I can start with, go ahead and just bite down and close the jaw, and then relax and soften, and we can do that repeatedly. I'll work up into the parietal fascia and around the ear, circling back toward the styloid process. Go ahead and bite down again, and so we go from an area of contraction and then relax, and now go into a soft opening, into a yawn, and open the jaw completely, and work all the way through. Following the go ahead and close. Following the instrumentation, I may change instruments just to change the mechanical advantage or the leverage, and again come in through the zygomatic arch, up through the parietal lobe again, and working this connective tissue of the cranial fascia. And again, encouraging, go ahead and close the jaw, bite down, and then relax and open the jaw. Going from more broad strokes to more specificity, I'll change the instrument once again and go to a smaller edge and try to get into that articular surface using the tip of this smaller HawkGrip instrument, and then relax that jaw. I could gently circle around and provide some lateral resistance to the jaw. So go ahead and push resist me from pulling. And so you're gonna keep your eyes facing forward and just don't let me turn you. And so I start pulling on that jaw and changing the force. And then relax, again resist me as I push from the other way. Don't let me move you. And then finally, utilizing the instruments, I'll come with this hook, one of the advantages of using instruments that we can't leverage with our hands. And if we come into the ear and come gently forward, we can actually articulate and strum right against the back of that TMJ. So again, I would encourage some biting down or closing down, increasing the fascial forces, and then open the jaw. And as he opens the jaw, I'm pulling directly anterior, so it's a P to A force, and strumming the back of that jaw. Okay? Relax there. Most of everything we just did is compressive in nature. And for years, whether it was manual therapy, utilizing our hands or tools, it's always been shearing, compression type of forces. What's really exciting is adding distraction type forces or separation type forces. And so now we can come with some cups, and HawkGrips makes a set of cupping tools of different sizes, including the ability to get into smaller areas on the wrist, the hands, the feet, but also the TMJ. And so using a very small cup, I can come and I can apply that force and allow that cup pressure to expand the myofascial tissue on that TMJ, and then go ahead and then work through their available range of motion. So I can ask the client again to go ahead and gently open the jaw and then close. And so utilizing the cupping with some dynamic movement, again, open and close. And oftentimes I will encourage them to take their range of motion up to the point of provocation where they feel the restriction, where the pain is. And so we're doing myofascial distraction, effective cupping here with dynamic motion, and then relax. If I thought it was important and wanted to readjust that cup, I could keep the client static themselves, but then just move the cup and try to get that distraction through the fascia, overlapping, in this case, the TMJ. So these are examples utilizing both instruments of compression and shearing forces, as well as cupping for distraction forces, to give you a different approach to treating TMJ.